The following program was previously recorded.
I was depressed with no motivation for anything and suicidal.
If you've been struggling in the aftermath of the pandemic,
I know a lot of people like to dismiss feelings, but feelings are key.
And can't seem to find a way out.
So what we see these days are a lot of trauma. There's a lot of family systems challenges. Depression, anxiety rates are rising. And suicidality is a major challenge for teenagers, especially right now.
No matter where you are in the journey.
It wasn't until I had already had a couple of attempted suicides that I actually got into counseling services and started medication.
We hope you'll stop for a moment and listen.
We cannot heal ourselves. We can't just pull ourselves up from our bootstraps. That's not the way it works.
No matter where you live or what you're feeling in your own journey, your mental health matters.
We think about things like smoking or heart disease, but new evidence shows that mental health can be a contributor, in some cases even more, to premature death than some of these things that we know are the major drivers.
And from treatment of loss and grief,
so I've never experienced such grief in a short amount of time,
to overcoming addiction.
The first time I sought treatment or help within the community, I was 17, so I went pretty hard, pretty fast.
We want you to know there is hope.
Mental health is not a luxury, it's a necessity.
And help.
We see a lot more depression and anxiety coming in that wonder what's happening in the world and how is it going to affect me.
In this next hour that could be life-changing.
Your Mental Health, sponsored by NAMI, Butler County Mental Health and Addiction Recovery Services Board, Beckett Springs, Warren County Mental Health Recovery Board, Community First Solutions, the Lindner Center of Hope, Cincinnati Center for DBT, Emma Schmidt and Associates Sex and Relationship Therapy, and Best Point Education and Behavioral Therapy.
Hello, everyone, and welcome to Your Mental Health. It is a town hall that if you've been struggling with depression, anxiety, suicidal thoughts, or even just how to cope in some of these tough times, this hour is dedicated to help and hope that you may need in the journey ahead. We have great local resources all in-house today. Take a look at this. This team here standing by, telling us what's available in our community, from free programs for your family to inpatient care if someone you love is in crisis. And in just a moment, we're going to begin with this team from NAMI and Best Point. We are so glad to have them in-house. They have programs for the youth in our community, as well as peer support that you can get virtually or in person. And they're here to talk about the early warning signs someone may need mental health help. But we do want to begin by setting up our discussion with a young lady named Heatlh. After a lifetime of trauma, she says she finally had the courage to tell someone that she was in crisis. Now she wants others to know there is no shame in asking for support.
My whole world changed. I just opened up.
It is hard to believe that this now thriving 18-year-old had days so dark the past 2 years she could barely get out of bed.
I was depressed with no motivation for anything and suicidal.
Samaya had recently moved from California to Ohio in hopes of escaping an abusive home life. But by the time she got to Pamela Bowers, an outpatient therapist at Ohio's Central Clinic Behavioral Health, she admitted she still didn't feel safe at home.
And I know a lot of people like to dismiss feelings, but feelings are key.
Bowers became an advocate for Samaya. Together, they made the decision to have Samaya step away from her biological family and go into foster care. It completely changed Samaya's life.
I used to suffer from really bad nightmares from PTSD and my fear of being around men. She's helped me.
Samaya says she's now so much better that along with Bowers, her mission is to stop the stigma around reaching out for mental health help so other teens don't wait.
Find someone that you can really talk to.
Bowers told me the only way to make seeking mental health care as normal as physical health care is to do a couple of things. The first is to put counselors in pediatricians and primary care doctors' offices. Several care centers have now started to do this, including here at Ohio's TriHealth.
There is so much research to support that embedding behavioral health consultants in a primary care setting reduces stigma, because patients are just going into their doctor's office. They're not going into a separate mental health facility.
Second way to normalize the mental health conversation and stop the stigma is to make it a regular part of a teenager's day. Grant Us Hope does this in schools.
We partner with schools and the educational service centers, the administrations, the staff, and the students especially on putting together what we call a Hope Squad.
These students are now trained as Hope Squad peer counselors.
And we have QR codes set up around the school so people can scan them, and they can either request someone specific to talk to or just get randomly someone.
Finally, Bowers says to stop the stigma around mental health help, advocates need to teach others to be advocates.
My goal for college and for when I am older is to advocate for women who are victims of violent crimes, and that I have a bright future ahead of me and that my past doesn't define me.
So Samaya told me that she is now comfortable sharing she is a survivor of abuse. Putting her face on the story, of course, helps stop the stigma. Part of the reason we wanted this team here today, Katie Harper from NAMI, Danny Green from Best Point Behavioral Health, was that she got into counseling early. And I'm betting that both of you, I'll start with you, know what a difference that can make.
Yeah, absolutely. Early intervention is key.
And I know you offer a variety of services, so let's start with what you do and where you're from, and just tell us a little bit about your company there.
Yeah, thank you for having me. I'm Danny Green. I'm the Vice President of Counseling Programs with Best Point Education and Behavioral Health. At our agency, we serve kids really infancy through high school and community programs throughout the greater Cincinnati area. We are in 85 schools where we can provide counseling services directly in the school setting to really decrease those barriers and help those individuals get connected earlier. We know that the wait time between onset of symptoms and connecting to care can be sometimes 8 years. So we want to get with kids early when they're starting to show those signs and symptoms. We also have services for adults. We have a counseling for caregivers program for our parents and guardians who are struggling as well. So we offer a wide variety of services, including services like care coordination, where we can work with families in the home, help with resources, and work on parenting tips as well.
Boy, I bet you've had huge demand just since COVID-19, have you not?
We have. So we have seen our referrals increase over 35% since the beginning of 2020. This past year, we received over 5,000 referrals for services to date in this last fiscal year. We know kids are struggling, and we are continuing to see a rise of kids who are needing access to mental health care.
Yeah, excellent. So we're so glad to have you here. Let's talk about what NAMI is and what they do, because I know you sort of fill in these places where maybe people don't have some formalized care.
Yeah, so NAMI is the National Alliance on Mental Illness. We provide education and support, advocacy, and public awareness for individuals and their families who are affected by mental illness. Here in Southwest Ohio, we serve Hamilton, Claremont, Warren, and Clinton counties. So we have programs and services across all of those counties, in the schools, in the community, as well as a helpline to help connect people to those resources and get started on that journey, find people like Best Point if they don't know that they're there, and just help make those connections.
So I want to ask each of you, and we do have just a little video or some photos that you sent us, what are you seeing as the early warning signs that are sort of coming to you?
Yeah, that's a great question. Early warning signs, I would say, would be any significant change in behavior. An increase or a decrease in sleep, an increase or a decrease in eating habits, withdrawal or isolation, increased aggression or irritability in kids is a big sign and symptom of mental health. So any significant change in behavior that an individual may be experiencing could be an early warning sign of struggling with mental health.
Different for you. Okay, and then we also have a little bit from NAMI. I know you have a wonderful website, and I just want you to share, there's a wide array, certainly, of illnesses, but when you start to see some of the changes she mentioned, what do you often see?
Yes, so every illness is going to be different, and every illness is going to manifest differently for different people. So for one person, that may be that withdrawal that she mentioned, where you're withdrawing from your family, from your friends. For another person, that could be disordered thinking, extreme highs followed by extreme lows, and we're cycling back and forth. And it's just important that as you take note of those things, we're not trying to self-diagnose. We're not trying to say, oh, I'm experiencing this, so I must have XYZ. We're seeking help from professionals professionals to figure out how to help you and put you on that path.
And everyone in this program certainly has that model where we're trying to just give you insight so you'll find the right resources. One of the things we want to make sure we do is make sure that people know how to find you and where you are. So if someone wants to reach out to Best Point, what do we do?
You can go to our website, which is bestpoint.org. You can also call our main line, which is 513-272-2800. Ask to speak to anybody in our intake department, and they will connect you to the wide variety of services that we offer.
And for NAMI?
For NAMI, you can visit namiswo.org, or you can call our helpline at 513-351-3500, and you will get a live local human when you call that.
You know, that is so important. People always say, you know, I get kind of in this pathway, but talking to a human will at least get you to the next contact. You guys are wonderful resources. We're grateful that you're here. We kind of started with you because this is such a foundation that's so important. Again, don't be afraid to reach out to them. We also want to remind you that there is a mental health hotline. If someone that you love is in crisis, that number, of course, the 988 number that we've been hearing a lot about, and that too is available 24/7 for anyone in crisis. We're going to continue to be talking about that throughout the hour. Thank you both for being here today. Pleasure to share your work.
Thank you.
All right, just ahead, we talk mental health treatment options. You may need inpatient recovery care or referral to a specialized mental health provider. So we're going to meet Dr. Paul Crosby. He is here from the Linder Center of Hope, and Colleen Chamberlain from the Mental Health Recovery Board. Both are going to share just what's available. But first, we do want you to know that they can help those such as Ellie. So listen to this.
I was cutting, I was burning myself, really anything to make a different type of pain, really. So.
And you were hoping that that pain would distract you from what?
Yes, well, from life, you know, just like alone with my thoughts, really.
She came to me initially in the middle of the worst of the pandemic and said, I don't feel safe, I need to go to the ER. And I kind of was like, oh man, is there any way we can put this off for an appointment or something? We don't need to be in the ER in the middle of the pandemic.
So that was actually Ellie's mom, and we met Ellie before the break. And one of the things, welcome back, by the way, to our mental health town hall. One of the things we heard from Ellie's mom was that a lot of people, if they don't go to the emergency room, do not know where else to go or where else to call. So we are continuing with our mental health town hall today with some of the great resources in the tri-state. I want to welcome Dr. Paul Crosby. He's from the Linder Center of Hope. And Colleen Chamberlain is with the Mental Health and Recovery Board. Let's start with just a couple things that we need from each of you. Tell us a little bit about who you serve.
Sure. So my name's Paul Crosby. I'm the president and CEO of the Linder Center of Hope, and we are a comprehensive mental health center of excellence located in Mason, Ohio. We really were founded to try to bring the best possible mental health care to the Cincinnati region. We have what we call a complete campus of care, which means that we provide almost every level of care, everything from the most acute inpatient to residential to partial hospital and day treatment and intensive outpatient to outpatient psychotherapy and medication management. We also provide a lot of telehealth, and we've been doing that since the pandemic and plan to continue to do so going forward. We see about 50,000 visits per year in our outpatient practice, and we have about 70 clinicians. And so the point of that is to try to concentrate as much expertise in one place as we can and try to really serve as many people as we can.
Yeah, and I know I've personally had to pick up the phone and call someone where you are, and someone always responds, and I have to say thank you for that. And then, of course, we want to make sure that people know you have some broader services. You know, that might be one specialized place, but you are with just kind of an amazing board. Tell us about that.
So the Mental Health Board is the governmental agency that receives state, local, and federal funds. And what we do with those is we contract for the services that are needed in the community, whether it's with for-profits or not-for-profits, to provide counseling services, housing, vocational services, a broader range. So we have about 20 different organizations that provide services for us. And that's and we're also the crisis safety net for the community. So there is the 988 mental health line, but we also have a local line. If you call that crisis line, which is 877-695-NEED, you will get connections to local resources such as outpatient counseling, medication, crisis services, mobile crisis services, addiction services, all of the things that folks may or may not be able to afford in the private arena, we provide in the public arena.
Well, so important. We're going to continue this discussion in just a moment with both of them, because we really want to highlight just what some of those different treatments are, who they serve, and what they mean. So stay with us, and we do want to make sure that you know that this is your mental health town hall, and we hope throughout the hour that you'll find resources, hope, and help.
My experience with suicide, and I think the more awareness and the more conversations we have about it, the more the stigma will lessen and people will actually reach out for that help that they deserve.
It weighed heavily on me. It clouded my thinking, it clouded my judgment. It allowed, I'm not gonna say allowed, it caused me not to feel like I could really go on. I felt hopeless, and I really felt like I need emergency emotional mental health therapy, really.
So that's a wonderful woman named Tawana who just shared her story. She is actually a counselor who needed help as a counselor. And I know both of you encounter quite a bit just people in crisis, and it can happen in any walk. Dr. Paul Crosby's here, and we have just some video and photos of your facility. But I think people may not realize that you can help someone even like that, like at any level. I know you were founded sort of for that transition care, people transition out of children, but you do take all levels of care now, do you not?
We do, yeah. I mean, the truth is that our mental health affects every decision that all of us make our entire lives. You know, it can happen at any time that it makes sense to talk to a professional. And the Lindner Center was really built to handle the whole range of severity and the whole range of mental illnesses. So we can offer everything from outpatient psychotherapy, medication management, to the most severe acute behavioral health problems that exist.
Yeah, and it's wonderful to even have that resource. Colleen, I know you have more of an umbrella, but if you were going to talk to me and we, share some of your website and whatnot, who do you find yourself serving most? And it even seems like you can go to the homeless population, to people that need jobs. It seems like you address some of the treatment as part of your lifestyle. Is that a fair statement?
That is a fair statement. Not only do we subsidize treatment and make sure that people can get that, but you can have treatment, but if you don't have a good, stable environment to go back to, if you don't have a way to get your medications, if you don't have a place to live, or you don't have food, or you're looking for a job, all of those things will jeopardize any recovery that you might be in, whether it's in mental health recovery or in addiction recovery. So those are the things that traditional insurance and Medicaid and Medicare don't necessarily pay for. And so our local levy dollars then support those kind of things for the folks in our community.
Well, you both are wonderful resources. What we want to do throughout this hour is just share with you phone numbers and websites. So Lindner Center of Hope, if someone calls this number, what do they get?
So it's 513-473-HOPE, and that will get our main line. And you'll get a phone tree. It'll ask you what kind of services you're interested in, and you can choose your path.
And we have a 536 number as well. Just wanted to let people know that that number too will get you to the people you need. And for the Mental Health Recovery Board, if we call that need number,
you will get a trained person on the end to help assess whether it's a crisis situation that needs to be dispatched out, or if you're just looking for resources, and they'll connect you to those resources.
Excellent. We are so grateful to have you here in our community. Thanks for giving your time, and most importantly, just sort of giving your soul, because I know you are connected to the people you serve. You guys are wonderful.
Well, thank you for your time.
Yeah, thanks for being here today. All right, we also have links to all of the resources that you see today. It's at what'shappeninginhealth.com, so don't be afraid to go there if you're not sitting there and getting all these jotted down. We do want to continue this conversation, but first, if someone needs help, is it easier to get it from someone who's been there? Maybe.
Whether it's loneliness, depression, anxiety, fear. For myself, it was childhood sexual abuse that was a part of my story, and somebody walked with me, and now I desire more than anything to walk with others so that they would receive the same healing, the same hope, the same new life that is available.
So that is Kenda from the Eve Center. They're a faith-based free women's peer counseling center in our community. Just one of the ways to find hope and help. But sometimes you need a more structured program as well. Outpatient care, inpatient. So we have Heatlh. Heatlh's joining us shortly from Beckett Springs. She's going to share a little bit more about crisis care. You're watching our mental health town hall. Welcome back, everybody, to our mental health town hall. We are moving into crisis management in our next half hour. Going to be talking to Heatlh. She is here from Beckett Springs. They do a lot of crisis intervention there. But we do want to share a story of sort of what's behind the need for this, which is what the U.S. Surgeon General calls an epidemic of loneliness. I want to share the story of Elisa Owen. She says that her isolation and loneliness started when the pandemic changed her college experience her junior year.
I could tell looking back now that I had been starting to get very depressed over the summer.
Elisa says the first week of that year at Ohio's Cedarville University, she got COVID-19 and needed to isolate appropriately in her dorm room.
And so I was there alone for about 2 weeks and had panic attacks by myself and didn't know what to do because nobody could be with me.
She finally realized, she says, she needed medical care, but only after she tried to take her own life.
I ended up in inpatient hospitalization in Kettering. It was the first time that I was around a bunch of other people who were dealing with all these same things as me.
And that is what Betsy Linnell, an assistant professor of psychology at Cedarville University, says is the first step to healing.
We cannot heal ourselves. We can't just pull ourselves up from our bootstraps. Like, that's not the way it works.
Well, COVID may be easing right now. This new Surgeon General's report says the pandemic of loneliness is at an all-time high. It is a hazard so dangerous it increases the risk of heart disease and stroke by 30%, the risk of dementia by 50%. It is also the strongest predictor of whether or not a person will consider suicide.
We are created for a relationship. And so the void of loneliness is actually helping us to seek what we truly need, which is connection to God, connection to each other.
Elisa told me she now wants others to know overcoming loneliness also takes time. She just finished her senior year at Cedarville and as a social work major, now hopes to help others in this same journey.
I have a much better understanding of what many of my clients are going through.
So one of the things both Elisa and psychologist Linnell stress is that you cannot heal from loneliness if all your friends are electronic. We need human relationships, so they suggest you start by simply having face-to-face conversations again as much as possible. And we do want to remind you as we go to break, if you or someone you love is in crisis, you can call that 988 number day or night for any kind of intervention. We'll be talking about self-medicating to overcome mental health challenges in our next half hour, how addiction goes along with a mental health concern. And to do that, Community First team members are here. Erin Day, we welcome you. And Joanna Lowry is here from the Butler County Mental Health and Addiction Recovery Services Board. It's all just ahead on your Mental Health Town Hall. But first, a word about this challenge from Stacy.
It was more at that point trying to cover up feelings. You know, I found out that drugs and alcohol covered up the feelings I didn't want to feel anymore.
And it works for a little while.
It works for a little while and then everything's worse, yeah.
Your Mental Health, sponsored by NAMI, Butler County Mental Health and Addiction Recovery Services Board, Beckett Springs, Warren County Mental Health Recovery Board, Community First Solutions, the Lindner Center of Hope, Cincinnati Center for DBT, Emma Schmidt and Associates Sex and Relationship Therapy, and Best Point Education and Behavioral Therapy.
Welcome back, everybody, to our second half hour here of our Mental Health Town Hall. Those providing care say they are seeing more patients in crisis than ever before.
We see a lot more depression and anxiety coming in that wonder what's happening in the world and how is it going to affect me.
Now that is Kimberly Magis of Central Clinic Behavioral Health. We met up with her at this luncheon at the Kenwood Country Club, where they were honoring mental health providers, and they were also giving Joe Burrow's dad an award for the Burrow Foundation's funding efforts to help families with mental health and recovery. So this, of course, tells us how much this help is needed right now. We so appreciate those organizations that help fund care and counseling, but people really need to know who to reach out to in a crisis. So Heatlh, tell us who you are and what you do.
Sure. My name is Heatlh Farnbach. I am the Director of Clinical Services at Beckett Springs Hospital in Westchester.
And so we have a little video of your team and what's there, but you're thought of as an inpatient facility, but you offer a lot, especially for times of crisis, do you not?
We do, yes. So we are a 24/7 facility. We offer 24/7 assessments by phone, walk-in, and what we do is we assess for the proper level of care for whatever that person is going through. So whether that's an inpatient acute setting or whether that's more of an outpatient setting, such as partial hospitalization programming or intensive outpatient care, and we offer services for adults and adolescents and children.
So the reason that we wanted to talk about this is that oftentimes there's sort of a myth that if someone talks to you about wanting to take their own life and you start to have a conversation with them, that you might push them over the edge, or that might be the wrong thing to suggest. And so I said somebody needs to talk about this tough topic. If someone is saying, hey, I am considering taking my own life, what do you do? What do you ask them?
Well, I think that's, first of all, thank you for saying that that's a myth, because I don't think enough people talk about that it is a myth, and that we do have to talk about these tough things in order to develop safety for the people that we care about, or even a stranger who might be telling us what they're feeling. If somebody is having thoughts of wanting to hurt themselves, I think it's important to first ask them, okay, first of all, thank you for trusting me and telling me that, because this is tough. And it takes away some of that shame and guilt that many people feel when they're experiencing suicidality. And then, of course, you're wanting to assess, is this something that you've thought about for a while? Is this something that you have a specific plan? Do you have access to means? And that can help you determine which path to go. And maybe you do need to call a hotline such as the 988 number, or bring someone in to a behavioral health setting such as Beckett Springs, where there's 24/7 access to care to get somebody evaluated, just like you would if you were bringing someone to the ER who was having chest pains.
And I think that's what we're learning, that this is as important as your physical health, and we wouldn't tell you like, oh, well, you should just think other thoughts or something like that.
Absolutely.
Yeah.
Absolutely.
So we want to make sure for you, if people want to find you, you do have a 24-hour line. You gave that to us at 513-942-9500. If I call that with a person in crisis, what can you do?
If you call that with a person in crisis, you will be connected to an assessment specialist who will completely take it from there. They will ask questions, they can transport somebody in, they can send out mobile crisis if needed, or a local county's crisis response team. So we will absolutely get somebody the proper access to care quickly.
And all calls are confidential?
Absolutely.
I mean, I just think, we always think like, I don't want to give anything up for anyone, and knowing that we can call and that you have a safe place.
Yes.
We so appreciate who you are and what you do in our community.
Thank you. Thanks for having me.
Thanks for being here today and all you do with Beckett Springs.
Thank you.
All right, just ahead, self-medicating with drugs and alcohol can ease the ache of mental health problems, but Kate knows what that feels like.
I lost custody of my children. I had a terrible marriage. I was homeless. I struggled a lot in abusive relationships, pretty much a lot of bad things that added to the complex PTSD.
Welcome back, everybody, to our Mental Health Town Hall. Aaron Day from Community First Solutions joining us, and Joanna Lowry's here from the Butler County Mental Health and Addiction Recovery Services Board. Both of them here to talk about something very important, mental health, often the driver to addiction. We're going to be talking about this crisis in our community with both of them, but for one young woman who struggled with trauma and addiction for years, she said getting that mental health help was her key to recovery.
I felt broken my whole life.
Stacy Watson says that brokenness eventually led her here.
I found out that drugs and alcohol covered up the feelings I didn't want to feel anymore.
To Kentucky's Reset Ministries.
We help men and women who are coming out of either treatment or incarceration put their life back together.
But by the time she got to Reset, Stacy had a full-blown mental health crisis.
Part of my story is mental illness. It's a big part. because later on I was diagnosed with bipolar disorder.
Eric Schweitzer, the executive director here, told me Stacy's story is all too common.
80% of our folks coming in have a diagnosed mental health, and so we can't support that.
And so his organization, like many other nonprofits who treat addiction, trying to fill a critical void.
But we see it just showing up with so many of our clients. We're just trying to figure out how do we help fill that gap, because without that support, we don't want to send them back out with that essentially being untreated.
The National Institutes of Health now says as many as 60% of those with substance use disorders meet the criteria for another mental illness. And more than 1 in 4 adults living with a serious mental health problem also struggle with addiction. So now organizations that treat these addictions are putting out the word. They need trained mental health volunteers who may be able to help them meet the need.
It's just a little shift, a perspective in your thinking that can change everything, just from an I can't to an I can.
Now, if you can help in any way with peer or volunteer counseling with a professional service, the team at Reset would love to talk to you. 859-512-2729. That's the number for the resident director phone. They do take both men and women as part of this recovery program, and it is at no cost to you. So I know 2 of you are all too familiar with this. Erin, let's start with you. We have just a little video of kind of what your community services do, but how do you play a role in addiction and mental health?
Yeah, so at Community First Solutions, we offer a broad spectrum of care for mental health and addiction services. So we do everything from individual counseling to intensive outpatient services to medication-assisted treatment. So you can tell we're from the very low end to the very high end of that spectrum.
And would you say that probably 80% of the people that you see as well, have some mental health struggle that get into addiction that are sort of self-medicating?
Yes, we know that with addiction, a lot of people are familiar with the statistic 1 in 5 for mental health. When you add addiction into that, that becomes 1 in 3.
Wow. So I know the 2 of you have some overlap, which is good that you have lots of resources, but we know that it's really important to reach the rural areas. You've been hit so hard. I say rural, I don't think of Butler County as all rural, but you do have some neighborhoods there that people may not know that you're even available. So tell us a little bit about your mental health board and what you do.
So we receive local, state, and federal funding to subsidize and support mental health and addiction services in the community. So we really try to look at what are those gaps and needs in services and support those areas. We also, there's the 988 line, and we also have a local mental health and addiction crisis line, 1884-CRISIS.
So I always think, and we do have those phone numbers, so stand by for just a moment. I always think that most of the time you're just trying to squash down whatever it is you're feeling, and the addiction often starts maybe innocently enough. A couple drinks eases the pain and whatnot. Do you hear that a lot?
Yes, we do. Many people, it's a continuum. They really start, and everybody doesn't start off with heavy use. It can really start very small. We talked about the pandemic and how that loneliness and isolation really can be fuel for people to develop mental health and addiction concerns. And we know that most people are dually diagnosed, so they maybe have issues with both.
Yeah, and that story Eric told me, our people need people. That if you have addiction, isolating people is one of the worst things you can do. So tell me, how does Community First, you often think this is too expensive, I can have it. How do you address sort of people at all levels of need?
Yeah, well, the nice part about Community First Solutions is that we accept pretty much all major insurance plans. We also accept Medicaid and Medicare. And then that collaboration comes in with, we collaborate with Joanna and the Mental Health Board, where they'll provide some of that subsidy for maybe someone who maybe is in between jobs and maybe doesn't have insurance or is indigent at that point in time. And so we work with them and provide them those services in conjunction with the board.
All right, let's tell people that phone number that you have for our mental health board. If they call that line, what happens?
They will talk to a trained professional. They can get help with both mental health and addiction crises for adults and children. They can also get connected to the HOTLINE, which is a team of professionals that connect people to treatment.
And it's critical you get them right away, is it not? Like when you're ready,
Yes.
make that call. Yeah.
Yes, as soon as you're ready, or even if you just have questions, please call the line.
All right, and Community First, we have a number for you as well. If you call there, what happens?
Yeah, so if you call our number, if you go onto our website, community-first.org, you can find our list of services, and then basically you'll connect with a person, and then we'll kind of work you through our intake process and what that looks like and what you need to bring with you, and then we'll get you started with services.
And you mentioned you have the medical assisted therapy. For people not familiar, what is that?
Yeah, MAT is the abbreviation, and that's the medication assisted therapy, and so we use medications like Vivitrol and Suboxone, and so we use those as replacements or blockers. And so oftentimes that is, one of the biggest things folks say that they have fear of getting into recovery is fear of the withdrawal symptoms. And so when I fear withdrawal, I don't necessarily know that I want to go into treatment. And so what we try and do with those therapies and even our outpatient detox is try and lessen those withdrawal symptoms, help give you comfort medications, and really ease that process so that then you can start to focus on those next steps of the counseling and the support groups and things like that.
So important. I tell people it's no different than giving a hungry person a meal. You can't listen until you've been through that crisis point. Thank you both for the collaboration you have. Thank you for being here today and for serving the communities that you do.
Thank you.
We love your work. All right, if you can or need help in any way, and if you'd like to also maybe reach out to reset that story you saw, I want to give you that number one more time as well, 859-512-2729. There are so many places right now where people need mental health help. That's why we're putting out all these resources so someone you love, there is a place for them to go. You can also find links to all of these places at what'shappeninginhealth.com.
It's going to be hard, but it's going to be worth it.
And just ahead, a program that offers free counseling as part of a research trial. We're going to introduce you to this team as well. Nikki Winchester and Emma Schmidt are in the house, and they have some unique therapies you might not have heard about. We'll tell you about them all next in our Mental Health Town Hall. Welcome back to our Mental Health Town Hall. We're joined now by Dr. Nikki Winchester of Cincinnati Center for DBT, and Emma Schmidt is here of Emma Schmidt and Associates. And they do a very different type of therapy. Doesn't always involve medication. If you're on it, you can still go, but it doesn't require it. So let's first start with Dr. Nikki. Tell us who you are and what you do.
Yes, hi, my name is Dr. Nikki Winchester. I'm founder and CEO of Cincinnati Center for DBT, also a clinical psychologist.
So DBT, for the world that does not know, is what?
DBT is dialectical behavior therapy, and it's an evidence-based treatment for a lot of different things, but especially things like borderline personality disorder, suicide, self-harm, can be very helpful with PTSD, depression, and anxiety as well.
And my understanding is that you kind of walk us through specific approaches to stopping a behavior or intervening in a crisis. Is that a fair way to say it?
Absolutely, absolutely.
And you do that in sessions, or how does it work?
So DBT is a multimodal treatment. One of the things most people are familiar with is our skills training group, where people are learning different skills like distress tolerance, interpersonal effectiveness, emotion regulation, and mindfulness. Skills that many of us did not learn early on. And we're learning how to tolerate our emotions and change our emotions to build lives we experience as worth living. And there's also an individual therapy component that is, it's cognitive behavioral therapy, so it's very different than your traditional talk therapy. We are getting people doing things, acting outside a session. They're always leaving with a homework assignment, because having an hour or so in a week of therapy is just not enough to make big changes. So people are really working hard outside of sessions too to implement skills and get to the life and the goals that they want.
Excellent. All right. And Emma is a sexologist. I had to ask her what that is and what that means.
Yep. Yeah, so I'm a clinical sexologist, which really breaks down into the study of sex, and I'm also a certified sex therapist. So at my core, I'm a counselor. And we then specialize in sex and relationship therapy. So when you come into the session, whether you're an individual, a couple, a relationship, you're doing talk therapy, and then we send you home for some fun stuff with homework. But really, when couples or individuals or relationships come in, they're usually at the end of their rope, or they're experiencing some kind of distress. They're looking at Instagram and TikToks, and they're like, why do I not have this perfect life, right? And we're here to say, like,
you're normal. Like these things are common, right? You're experiencing sexual pain because there's a problem or there's a relationship dissatisfaction for a reason, and we want to help you get to the core of what that is. And so for sex therapy, we had 11,000 sessions last year. And so we really want to help people know that people are seeking out sex therapy because it's common, your problem is common, and so we want to help normalize that conversation for people.
You know, I do think that's important because, you know, that's probably the person you spend the most time with in your life, the person you're in a relationship with, and so how you influence each other is critical. And I love that you're here, and I love that you do what you do. All right, we're going to continue this conversation with them. Don't go anywhere. We know that you might be wondering if you might benefit from something like this. We will tell you that. And up next, we're also going to continue the conversation a little bit more about something you're going to hear now from Kate Schroeder from Interact for Health.
There's just data out this week talking about how much mental health can contribute to premature death. We think about things like smoking or heart disease, but new evidence shows that mental health can be a contributor, in some cases even more, to premature death than some of these things that we know are the major drivers. And so in those neighborhoods, if you don't have safe, stable housing, if you are surrounded by violence in your community, that is going to contribute to your ability to get through the day.
Welcome back. We are wrapping up our mental health town hall with Emma Schmidt, who does sex and relationship therapy, and Dr. Nikki Winchester, who is with the DBT Center. So first, who would benefit from DBT?
People with big emotions who have a difficult time coping. And so that's usually borderline personality disorder, people who engage in self-harm, who have histories of suicide attempts, deep depression, substance use. It can be very helpful for PTSD as a precursor to help people get skills to do that rigorous treatment. We also see a lot of LGBTQIA+ clients. And we tend to see clients who have tried other things and they don't work. You know, they've
and
tried
I think
the talk
that is
therapy.
Many of us.
Yes.
Like you go, if you've tried other things, go to this. All right, Dr. Emma, who do you most see? Like you said, you know, you'd be surprised at who seeks a sexologist or a relationship therapy.
Yeah, so a lot of people think, oh, it's because I need to spice up my relationship, but actually the people who tend to call us have desire discrepancy, right? Like I want desire more than my partner, or people who have sexual pain or erectile dysfunction or shame around their sexual identity, or just don't even know how to approach talking about sex with their kids or their partner or themselves. And so usually people come in at the end of their rope. They've tried out all the other therapies and they're like, I don't know, should we try this thing? And we find that even after the very first session, people are like, wow, that was actually very helpful just to start to bring it up, just to start to talk about it. And so if you're struggling with one of those, don't wait till the end of your rope, though we can still help you because I feel like we're magical workers. And also know that, like, be proactive about it. It's okay to seek out therapy, whatever stage you're in your relationship.
That is such an important topic. All right, let's put your phone numbers up. We're going to start with Dr. Nikki's first. Someone calls this number. You have a team of people that will allow them to just kind of meet up with you and.
Absolutely, yep. They can call our number, go to our website, or even schedule online. We're aware that many potential clients in the community are having a hard time getting calls back when they call, and so we have staffed someone there to be there during our business hours, 9 to 5:30, and we pride ourselves on getting back to people as soon as possible. So unless we've missed something, we're getting back to people and very reachable, and then that's where they can schedule that intake.
Yeah, that approachable. All right, Dr. Emma, if we call your number, what do you do?
Listen, we get that it's overwhelming. We have a lot of therapists, sex therapists on our team, which is great. So the person who you call is going to help match you with the right therapist based on your needs. So you say, hey, I'm having some erectile challenges, or hey, I'm working through infidelity. They're going to say, here are your best options for the therapists on our team who are experts in that space. And so you're going to get connected with that person to take the guesswork out of all of it.
Yeah, we're so glad to have you here. Stick around because we're just going to wind down this show. There's something really important that we want to share. The Strive Mental Health Treatment Program reduces suicide and attempts to save lives. And according to researchers who are working with members of our military, they are now expanding this program, and it's open to anyone nationwide. What started as pain from a leg injury in the Marine Corps eventually led Kelsey Chrisman to the Strive program. She said at the time she felt
like I wasn't going anywhere. Everything was a mistake. Weirdly enough, my chain of command thought I was faking it. I'm like, no, like I hurt to walk.
That hurt eventually led to a diagnosis of post-traumatic stress disorder. It got magnified, she says, when on the same side she lost 2 of her toes in an accident at home.
I had to take the time to realize that this is my new normal.
The Ohio State University Wexner Medical Center runs the STRIVE program and provided this video. STRIVE stands for the Suicide and Trauma Reduction Initiative for Veterans. I spoke with Justin Baker, the director, about how it's a research program that actually provides treatment through virtual counseling for just 2 weeks.
We do really rapid treatment so you can get better, back to your daily life.
The results have been astounding. Baker says at least 7 in 10 who meet the criteria for the study of having PTSD or suicidal thoughts develop personalized crisis plans and coping skills. They continue to use those in times of emotional distress.
In some ways, it's actually less painful because instead of dragging it out, you just get it done. People can set aside 2 weeks to focus on therapy much easier than they can set aside 3 months to focus on therapy.
It's going to be hard, but it's going to be worth it.
That is such an important statement. Hard, but worth it. We have links to all of these resources that you have heard about in this hour. And we so want to let you know that if you do need to reach out to someone, you cannot heal from that which you do not acknowledge. They are hoping that you will just do that. Take the first step and reach out to them. We do want to let you know that keeping it in the family isn't working for many people, although that's sort of part of our culture. So if something you've heard has touched your life, we want to remind you that all of these resources are in our community just for you. Hope you'll be back with us Sunday morning, 6 a.m. for what's happening in health. Until then, everybody, stay well and stay tuned.
This program was previously recorded.